charge of the whole team of tuberculosis. Good afternoon. Thank you very much, Dr. Carlos Espinal. I don't know what happened with the logging from Marcos Espinal. I would like to welcome you all to this session. So we will start with the first presentation. I will be the speaker. Slide, please. So we are going to talk about the epidemiologic situation in order to approach tuberculosis. And for that, we must understand the global framework of the approach for tuberculosis, whose third objective or aim is to put an end to the epidemics of AIDS, tuberculosis, malaria, and neglected tropical diseases, to fight hepatitis and those diseases transmitted by water and other communicable diseases. The vision is to have a zero death in a world free of tuberculosis, zero suffering and disease due to tuberculosis, and to end the pandemic of tuberculosis. The strategy for tuberculosis has 3 pillars and 4 principles, and we are going to quickly analyze each of these pillars to analyze all the interventions done worldwide in order to tackle tuberculosis. First pillar, then, we are talking about 4 components. It's attention and integrated prevention centered in the patient. This patient-centered aspect is really important because it focuses on all the interventions in order to ease people with tuberculosis, ease life of people with tuberculosis. We talk about the diagnosis and the sensitivity tests and the systematic screening of the contacts of people infected with tuberculosis. It also include treatment of persons with tuberculosis centered in the patient, including the multi-drug resistant tuberculosis. And it has to do also with the collaborative activities carried out for tuberculosis and HIV, as well as management of comorbidities. And the fourth pillar, or the fourth component, is related to the preventive treatment for the high-risk people and vaccination against TB. Second pillar talks about the audacious policies and support systems with 4 components. The first has to do with the political involvement or commitment with enough resources in order to approach the disease. Then the participation of the communities, of other civil social organizations, and all providers and people who take care of TB patients. Then the coverage policy, universal health coverage, those guidelines, notification of the cases, vital registries, and antibiotics. And then social protection, poverty mitigation, and several actions targeted to all the social determinants of this disease. Third pillar has to do with the intensification and the research and innovation as 2 components. One targeted to the discovery, the development, the quick adoption of the new tools, interventions, and strategies. And second one is research in order to optimize and to facilitate the implementation and to promote innovation. The situation that we have worldwide for TB, for 2018, there was an estimated, according to this data, 10 million cases of tuberculosis with 1.2 million of deaths of TB without HIV and 251,000 deaths in people with VIH.
Entre
with
ellos los que
HIV,
también se
and
consideran
almost
multiresistentes, o sea, a
6,000 new
rifampicina,
cases
Epsilon
of
y a isoniazida.
multi-resistant
Siguiente.
tuberculosis.
Tenemos además la situación de
Then we have
la incidencia estimada de
this
tuberculosis
other
en el mundo.
scenario, the
En color más
estimated
oscuro
incidence of
pueden ver ustedes los
TB. In a
países que
darker
tienen una
color,
mayor
you can see
incidencia de
those countries that
tuberculosis
have a higher
y
incidence of
en la parte
tuberculosis.
inferior izquierda la
And
distribución de los casos
in the
incidentes de TB en los
left lower
diferentes
part of
continentes.
this graph,
Como se pueden dar
the
cuenta, en
distribution
el
of the
caso de las
incident
Américas
cases.
representa
In the case
solamente
of
el
the Americas,
3% de
this
toda
represents
la
3% of
incidencia de tuberculosis en
all
el
the
mundo, pero no
incidents
por
of
ello deja de ser
tuberculosis
importante en
worldwide,
nuestra
but
región.
not for
Siguiente.
that is less important.
Tenemos también la información sobre la
We also
incidencia
have
estimada de
information about the
tuberculosis
estimated incidence
resistente a
of
rifampicina y multidrogoresistente
multi-resistant
y allí vemos
tuberculosis and
claramente que son tres países,
rifampicin-resistant
los círculos de
tuberculosis.
color
And
morado
you
indican
see
la
three
proporción
countries
de
within
casos
this purple
incidentes
circle
y
that
el
indicate a different
50% de todos
proportion
los
of the
casos
incident cases, and
resistentes a isoniazida y
50%
rifampicina
which are
en
resistant
el
to
mundo o
isoniazid
resistentes a
and
rifampicina se
rifampicin
encuentran en
or
India,
rifampicin
Rusia y
alone are
China
located
con los
between
porcentajes que
India,
aparecen en la
China,
parte
and
inferior de esta
Russia with
diapositiva.
these percentages
Siguiente.
that you see below.
Tenemos también la situación en
We
las
also have
Américas
the
y
situation
se
in the
estima para el
Americas. It is
2018
estimated
tuberculosis
for
todas las formas,
2018 all
289 mil
forms of
casos con 23
tuberculosis,
mil muertes
almost
estimadas y
109,000 cases with
además en la
23,000
coinfección 29
estimated
mil
deaths,
casos
and
de
on
personas
co-infection,
coinfectadas y 6 mil
29,000
muertes estimadas.
co-infected
Y lo que
and
quiero señalar
6,000
acá es que
deaths.
se estimaron para
On
el
2.19
2018
year,
11
estimated
mil
for
casos de
2018,
tuberculosis resistente a
11,000
rifampicina
of
o
resistant
multidrogo resistente con
tuberculosis
1.000
either
muertes estimadas
multi-drug
para ese mismo
resistance
año
or
de
rifampicin
esta
resistance,
forma de
with almost
tuberculosis.
1,000
Siguiente.
of estimated death for this
Tenemos
form of
también
TB.
aquí planteado los 10 países que aportan
Here we
mayor
have
casos de
the
tuberculosis
10
RR-MDR
countries
y
that have
este es un total de
resistant tuberculosis, and
86.9% de todos
this
los casos
is
están
at
en estos 10 países. E importante
86.9%. Most of the
resaltar
cases
que los
located
dos
in this
primeros
countries, and
países
it is
que más
important to point
aportan
out
son
that
Perú y Brasil,
Peru and
donde
Brazil are
tenemos
the countries that
29.1% por
provide
ciento para el caso de
the
Perú y
greatest number of
22.7% para el caso
cases,
de Brasil.
29% for
Siguiente.
Peru and almost 23% for Brazil.
Esta es la tendencia de notificación de los casos
This
de
is the
tuberculosis
trend of reporting
multidrogoresistentes o
in the
resistentes a
TB cases,
rifampicina y
which
como
is
ustedes se pueden dar
resistant to
cuenta en la línea amarilla,
rifampicin. And
estamos
you can see
planteando
in the
datos en
yellow
todas las
line,
regiones de las Américas que
we
han
are
ido
seeing the
aumentando
resistance in all
levemente
the
a esta
region of the
notificación
Americas,
y
which
en
increases,
mayor
as you see,
medida en los
towards
países de Asia, en los
2018,
10 países
and
de alta carga de tuberculosis
it
resistente a
increases even more
rifampicina
in the high
y
load countries, which are
aumentando
those that show cases of
aumentando
resistant
más esa
TB.
notificación. Siguiente. Y acá tenemos en el
And
lapso de 2016 a 2018
between 2016 and
la
2018,
situación de tuberculosis,
we
casos de
have
tuberculosis resistente a rifampicina
the
y multidrogo
cases of
resistente en las
resistant
diferentes
tuberculosis
latitudes
are either
representan los casos
multi-resistant
estimados
or
para las
rifampicin
regiones.
resistant. In
En
blue,
rojo los
number
números de
of
casos
estimated
notificados
cases,
y en
number of
amarillo
reported
los
cases in
notificados
red,
específicos
and
a
in
tratamiento.
orange,
Como se pueden dar
those
cuenta, hay una
reported
importante
cases
brecha
that are
en
under
casos
treatment.
estimados y aquellos notificados
Between the estimated
y
cases and those
desafortunadamente la
diagnosed and
notificación
those
de los casos
treated, there is a gap,
un poco
as you
más
can see
reducido. Es
here.
importante destacar
It is
que el
important to point out that
88.3% de esos casos notificados iniciaron
88.3%
tratamiento,
of the
mejora esta
reported
situación
cases
en años
started a
anteriores.
treatment,
Siguiente.
which is better than the situation in previous years.
Acá vemos que
We
para
see
poder
here the
diagnosticar
proportion.
de manera mejor todo el espectro
To
de la
be
resistencia
able to
y la
better
inmunodeficiencia
diagnose
o la
resistant,
heterozigidad,
we need to
esta
perform
es la cobertura
sensitivity
de las
tests,
pruebas de
and this is the
sensibilidad
coverage of
en
the
estos
different
últimos años a lo largo
sensitivity
desde el
tests throughout
2018.
the last years,
En
between
línea
2013
roja,
and
los casos nuevos, en
2018.
las líneas
In red, you see the
previamente
new
tratados.
cases, and in blue, the
Importante
previously
resaltar que
treated
más o
ones.
menos se mantiene en los últimos 4 años
And
los
throughout
valores
the
similares en los
last
pruebas de sensibilidad
4 years, you
siguen
see
siendo
similar
altos para la región a
values,
pesar de que
which are
comparativamente con años
still
anteriores se ha mejorado.
low for the region in spite of
Todas
being
estas cifras
higher
pueden
when
mejorar en las
to the previous years. So the message here is that we still have to improve in this situation with the resistant TB. And in the slide, we see all the reported cases which are rifampicin resistant or multi-drug resistant, and that have been also studied for resistant for second-line medication, which, as you can see here, the proportion is still limited with regards to the diagnosis. This has been the trend of those cases reported with multi-resistance to tuberculosis treatment in the Americas between 2011 and 2018. This is the extensively resistant tuberculosis, which are also resistant to the injectable quinolones. And these are the countries that in 2018 show all the cases which has extensive multi-resistant. Peru and Brazil are those cases with the highest number of reported multi-resistant cases. We also have the results from the treatments of those resistant tuberculosis, either for rifampicin or for multi-drugs or extensively multi-drug resistant. There is an increase in the rifampicin resistant and the multi-drug resistant. However, mortality has an impact in this, especially in the rifampicin resistant and multi-drug resistant. Peru has had a very effective approach in the management of the extensively drug-resistant tuberculosis. I would like to mention that there are two new medications to treat the multi-drug resistant tuberculosis, bedaquiline and delamanid, and this is the progression with the use of these two medications. Very few countries have introduced this new medication, and the information is going to be available, and that will show that in the region worldwide, these two medications have been widely used nowadays. And I would like to mention that we have some indicators for the end of the tuberculosis. In green, you see the indicators that have to do with the rifampicin resistance and the multi-drug resistant. We were here at 59% by 2018, and we want to reach in 2025 almost 90%. All those patients that have been diagnosed with quick tests, and in a few years, we must reach 90% with the results of the test which are sensible to the drugs. And in general, this must come to 100%, and with the tuberculosis with new medications that in 2018 we could not use because they were not available, because we did not have a regional coverage for those. We also have to mention the high-level meeting, the UN on TB, which was carried out in September 2018, and where all the member states of the United Nations committed to some very important aspects for prevention and control of the disease. Amongst them, one of the commitments was to treat 40 million people affected of TB, including 3.5 million children between 2018 and 2022. And in 2018, the progress in the Americas They estimate that 1.2 million of people affected by the Americas in that period. Of them, 238,000 had been treated in 2018, including approximately 14,000 children. These interventions were oriented to vulnerable populations. Also, there was a clearly established commitment for the same period to treat 1.5 million people with drug-resistant TB, and by 2018, of the 55,000 people estimated in the Americas, they already had treated 4,600, and we see the important gap that there still exists to reach that objective. Also, there is a commitment to may advance in the innovative products, and the capacity has been strengthened in the region with workshops called sorted workshops, and also they created national networks of research in TB. Four countries already have established them, and other countries are only also going to. And the beginning on operational investigations of treatments that are shortened and totally oral for drug-resistant TB, what's called short. It is rifampin-resistant TB. There will be a specific meeting on that type of research, and then all 8 countries have already been included in that process. I would also like to mention the impact of the pandemic due to COVID-19. It's important to mention that this has, of course, disrupted services because of the lockdown measures in most countries of the region. This has altered the services, health services provided to the population. Here we see preliminary information of 10 countries with data of the first semester of 2020 showing the impact of COVID-19 in TB case reporting. The first trimester is dark green, and the lightest green is the second semester. And we see how the majority of countries showed a decrease in TB case reporting during those periods, clearly showing that disruption in services. Also, we have to consider the impact of the pandemic on the financial and economic areas and the poverty levels. The first graph from Simple shows how in Latin America and the Caribbean, we see the GDP per capita has been altered. Given the situation, this has drastically decreased and led us to 2010 levels. So a delay, or actually a setback of 10 years. Um, the same thing happens as to evolution of poverty. This has increased to levels that show a setback in 14 years in poverty. This is a huge economic impact that, of course, is a determinant factor for TB prevalence and is one of the key determinants of this disease. Here we would like to mention that since the beginning of the pandemic from PAHO, the regional TB team has been in contact with all the national programs, the groups of advisors, the civil society, and experts in order to contribute information and support and how to share experiences in the approach of control of TB under the context of COVID. Alternatives have been explored to maintain the diagnostic services and treatment of TB services. Countries have made efforts in order to continue to provide those services, and especially in the case of multi-drug resistant TB, in order to maintain the supply of medicines and supplies, and also encourage the monitoring of the effect of the pandemic on TB. Now services are being um, reactivated, and follow-up of cases is now pursued. This is a summary of what's happening with multi-drug resistant TB in our region of the Americas and the impact that COVID has had on the situation. Thank you for your attention.